Starting with the case scenario. Michael Smith is a 55-year-old male who also happens to be a defense lawyer. He has a history of hypertension and high cholesterol. In his job, Michael has to travel a lot, which leaves him eating fatty takeout meals for days at a time. He has a BMI of 31 and a weight of 110 kilograms. Michael is a regular smoker. He smokes 20 to 25 cigarettes a day, but doesn't drink any alcohol. Michael has 3 children and a wife who is a stay-at-home woman, which leaves him as the breadwinner. His father died from an acute myocardial infarction at age of 60 and has an elder brother who suffers from coronary artery disease at an age of 59. This evening, Michael and his wife had a huge argument after dinner. Michael complained of chest pain and was quite sweaty. His wife decided to take him to the hospital that evening. Michael was admitted in ED at 2000. Possible diagnosis could be angina.
Now coming to pharmacological interventions. As Michael suffers from stable angina, we can carry out some very effective pharmacological interventions to maintain stable and balanced condition of Michael and improve his condition further. Anti-anginal drugs are the very first. They prevent attacks of angina by decreasing myocardial oxygen consumption and by increasing myocardial oxygen supply. There are 3 classes of drugs usually used: organic nitrates, beta blockers, and calcium channel blockers. Now coming to nitrates first. The medications used is glyceryl trinitrate, which is GTN. GTN comes as a tablets or sprays. You can take a dose under your tongue as required when your angina pain occurs. GTN is absorbed quickly into the blood when kept under the tongue. A dose eases the pain within a minute or so. Carry your GTN tablet or spray always with you. Some people prefer taking GTN before any exertion or exercise, for example before climbing stairs. If the first dose does not work, take a second dose after 5 minutes. If the pain remains for 10 minutes after taking GTN, then call an ambulance. GTN works by relaxing the blood vessels. This reduces the workload on the heart and helps to widen the coronary arteries and increase the flow of blood to the heart muscle. GTN tablets go off after a few weeks, so patients need a fresh supply every 8 weeks and should return any unused tablets to the pharmacist. Patient may prefer to use a GTN spray which has a longer shelf life than tablets. A dose of GTN can cause a headache or flushing for a short time. These side effects often improves or goes with continued use. Now talking about some of the contraindications of GTN. Hypersensitivity, systolic blood pressure lower than 110, bradycardia heart rate lower than 50, ventricular tachycardia inferior STEMI with systolic blood pressure lower than 160, and right ventricular infarct. Now talking about another important medicine for angina, which is aspirin. From centuries, aspirin is being used as analgesic and anti-inflammatory. However, its cardioprotective properties is being discovered few decades ago. As per Michael's condition, we will go through cardioprotective properties of aspirin. Firstly, how aspirin works. Aspirin prevents blood clots forming on the surface of ruptured atherosclerotic plaques, further reducing risk of heart attacks, strokes, or angina. These plaques build on the lining of blood vessels in response to injury from long exposure or suffering of high blood pressure, abnormal blood sugar levels, high cholesterol, and smoking. This relates to Michael's condition as a patient of high blood pressure, high cholesterol, and smoker. Platelets stick to plaques, resulting into clot formation, which further blocks blood flow to heart, causing heart attacks and angina. Now talking about dose of aspirin. First dose of aspirin should be 160 to 325 mg, but the normal dose is 75 to 325 mg once daily. Some of the side effects of aspirin are upper abdominal pain due to gastric irritation, which can be prevented taking aspirin with food. Second, gastrointestinal bleeding, which can be prevented by taking proton pump inhibitor. And third, allergy to aspirin resulting to asthma, which can be prevented by going under desensitization. Some of the contraindications of aspirin are active peptic ulcer, hypoprothromburia, or other coagulation disorders.
Now we talk about metoprolol. Metoprolol is classified as a drug under beta blockers. Beta blockers function by decreasing the pulse rate and myocardial contractility in order to lower the myocardial oxygen demand. Beta-1 adrenoreceptors are blocked as metoprolol is cardioselective. Dosage includes oral intake initially being 25 to 50 mg twice daily, and it continues over a period and increases to 50 to 100 mg 2 to 3 times daily. Contraindications include hypotension, history of asthma or COPD, and severe bradycardia. Side effects include fatigue, cardiovascular consequences such as bradycardia, arrhythmias, and precipitate asthma. Some safety and precautions include allergy to metoprolol and low blood pressure. Now we talk about a lipid-lowering agent called rosuvastatin that is clinically available for oral administration and is recommended with a complete diet, as the drug works by reducing the amount of LDLs but increasing that of HDLs, which further helps to decrease the risk of heart diseases and prevent stroke and other cardiovascular accidents. Mechanism of action includes the convenient acting of the drug on the LDL-C using phenomenon HMG-CoA reductase inhibition. It focuses in minimization of apolipoprotein B serum levels and to increase high-density lipoprotein cholesterol, that is known as HDL-C, by inhibiting its catabolism. The dosage includes the range that is in between 5 mg to 40 mg daily. Adverse effects such as muscle weakness or pain, memory problems, unusual tiredness are pretty common. Contraindications include liver disease, kidney disease, and especially alcohol use. Some safety and precautions include allergy to statins and yes, alcohol use as well. Just a heads up, before administering any medicine to the patient, we are supposed to check the 6 rights, 3 patient indicators, and most importantly, allergies to any medications